Hi, good morning, everybody. Welcome to the 15th episode of the Health System Fix podcast. My name is Dr. Gaurav Mishra. I'm a child, adolescent, and adult psychiatrist and a health systems design expert. My goal is to talk to people who have different professional and personal experiences with the health system and have solutions, ideas about how to do things better. I'm really honored that my guest is Assemblywoman Dr. Darshana Patel. She is the Assembly member to California State Assembly District 76 and was elected to represent Northern San Diego County in November of 2024. Dr. Patel is a research scientist. She's a former school board president and dedicated community leader. She's a daughter of immigrants and experienced firsthand the challenges of building a new life in California. Dr. Patel has her PhD in biophysics from the University of California, Irvine, and she worked in the biotechnology research space for a while. She also was a leader in the Poway Unified School District. Actually, my kids go to school in that district, and significantly reformed financial mismanagement and restored trust and governance in that district. She's also been the president of the San Diego County School Boards Association, and she's been a member of the California Commission on Asian and Pacific Islander American Affairs. And again, a lot of community work. So I'm really excited to welcome Dr. Patel.
Thank you so much. It's great to be here today. I haven't been on many podcasts before. This is probably my second one. So I'm really excited for our conversation.
Great. One of the ways I like to learn about people's experience and where they are in their thinking today is really looking at their life's journey. So I like to ask, maybe you can talk a little bit about what was life like growing up and before you started thinking about education or professional life?
Yeah, so that is a big question. As the daughter of Indian immigrants, journeys here and growing up in the US were quite varied and just full of adventure, but also hardship. I think many people who grow up as families of immigrants in America experience very similar things to what I did as a child. Truly a joyful childhood, but filled with a lot of challenges. My parents came in the late 60s for the Indian community. There weren't that many Indian people here. And my dad came as a civil engineer. That's what we were allowing immigration for at the time. And he was part of big infrastructure projects like dams, freeway overpasses, things like that. And what that meant for us as a family is we were directly impacted by recessions and hardships in economy. And my father would also chase jobs between where we immigrated in Pittsburgh, Pennsylvania, to Colorado, Arizona, back and forth between Colorado and Arizona a little bit. And then finally, we settled in California. During all those times, my mom worked very hard to give us a very stable home life, to make sure we focused on our education, that we had access to cultural enrichment when and where we could, even though the communities I mostly grew up in were mostly white. We didn't have temples to go to. We didn't have Indian community groups to hang out with and realize that there are more of us out there. Yeah, so it was full of those kinds of adventures. We had experiences where, of course, kids were curious as to why I would wear a bindi to school, because I used to do that when I was little. Or when I wore my hair in two braids, I was asked, what tribe am I from? Thinking that I was Native American. So very different than the world that I'm raising my kids in today, as you are raising your son in today. It's a very different world for our kids. I think equally challenging while they have exposure to, knowing more people that look like them and come from families like them. There's also more hardships that they're experiencing on the emotional, mental health side. And that is one of the things that I'm very focused on for California.
This raises an interesting thing about, because you grew up in the US, right? Now you're raising your kids. I immigrated here in 2009 and I'm raising my kids here. How do you think about your sense of belonging growing up in the US versus how your kids experience it? Do you think that's different? It's the same?
What a great question. It's very different. For sure, it's very different. I think growing up, the school I was at in Tucson, Arizona, for example, next to my brother and I in the elementary school, I have two brothers. One is significantly older than me, 6 years older than me. The other one is just a year and a half. So we were in schools together a lot. In our little elementary school in Tucson, we were the only white kids in the school. The next nearest foreign, sort of, so to speak, kids were the Italian triplets whose parents were from Italy. So they were also immigrant kids. but they certainly didn't present like immigrants. And so, for a sense of belonging, I was always asked and questioned why this, why that. And a lot of the times I accepted it as, just kids being kids, except for the time where I was, fingers were pointed at me when kids realized I was not Christian or Catholic and I was Hindu. And they pointed fingers at me and said, "Oh, you're a pagan." And that was quite a challenge to deal with. I don't think our kids deal with those sorts of things. Maybe some kids do in more rural communities. But in general, nowadays, I see kids being able to find community, whether that is online or in school, but also in their extracurricular activities. And community doesn't always have to be identity based community, but it's in their sports and their arts and academics. Kids are much more secure in trying to find where they belong, and they're more verbal about it. They express interest about it, and they let parents know a little bit better than what we would have done growing up, for sure. I never would have walked up to my dad and said, "Hey, dad, I need to find my community." But my kids certainly feel secure doing that with us as parents.
Yeah, it's interesting because for a while I thought, growing up in the US is easier. Obviously, I had just immigrated, like my kids were growing up. And then I realized, if I'm treated poorly, which is not right, but if I'm treated as somebody as an outsider, if I'm treated as one versus my kid is being treated as one, to me, I know I am an immigrant. So, to me, that, and it's not negative in any way for me. So for me, I do realize that if somebody thinks of me as an outsider, it doesn't necessarily disturb me because I grew up in India. I moved here when I was 26. Whereas for my child who grew up here, he's from here. For him to experience that, that is very different because I think that is a much more difficult experience.
Well, yeah, I mean, what you're saying is exactly correct. And I think as members of the API community specifically, we are constantly reminded that our physical, visual appearance definitely immediately points us out as immigrants to the United States in one generation or another, right? Whether we are the immigrant generation or it's our grandparents, right? And so I think for our kids experiencing that, like I experienced it, it was always very fascinating to think about. And I never quite appreciated that I was American until I studied a year abroad as a college student. And so I went to England to study for a year. I continued learning biochemistry. My bachelor's degree was in biochemistry, and I took a year in England. And mostly because I figured, hey, well, at least they speak English. So I didn't need a foreign language mastery. And I thought it would be great. They do use English very differently in England, I will say. And that was good learning for me. They also educate differently. Their education system is very different. So there was a lot of learning. And that's how I realized, oh, wait, I'm American. I realized that by my accent, the way I picked my food, what I preferred to eat, how I dressed. It was very American. I came home, I returned to California with a much stronger sense of self and identity and a lot more self confidence because it finally clicked to me that, yes, anywhere in the world I go, I am definitely American. And being American means you get to have all of your identities. It means you get to be Indian American. It means you get to be, for me, it meant I got to be a scientist. I get to be a mom. I have so many different identities and I can be proud of all of them at the same time. And that is what being American is all about. It's actually a beautiful thing if we just welcome that in others.
All our stories are much more complex and, more nuanced than on what appears on the surface. So, when you first started thinking about, college, you went to biotechnology. What was kind of the initial driver for you to?
Well, so this is one of those more of a sad immigrant story. At the time, we didn't have Affordable Care Act, right? So I was 14. My dad was just transitioning to a new job in California. We had just moved in July of 1988. And then that September, my mom, we didn't know she had an undiagnosed medical condition. She had extreme hypertension. We just didn't know. And she passed away from a massive hemorrhagic stroke. And it was something, you know, stroke is the silent killer, right? She looked healthy. She felt healthy. None of us really had a clue, but we didn't have health insurance and we didn't have regular health insurance anyway, as my dad changed jobs and sometimes he was unemployed. So it was quite an eye opener for me. It was very challenging. I mean, I went through all of the emotions you would imagine a 14-year-old girl would experience losing her mother. in a new town, going through changes physiologically. Adolescence is a wild mental space. As I've seen my own three daughters grow up and go through adolescence, it was quite challenging. But I was able to find purpose in those years in high school, knowing that my mom wanted me, like she'd always told me growing up, that I could be anything I wanted to be. In fact, she would often tell me that I was born in the US and I could be president one day. She said, when the kids bully you, remember that you were born in the US and you could be president one day. So her words and her encouragement and her nurturing reminded me that I have a purpose, that they sacrificed a lot for me to come to be born in America, for them to come here. And I had a purpose here. And for me, I was going to channel all of my energy into curing diseases. I didn't want anyone else to die of a silent disease. I was very focused in that. And I found that the best way for me to get through my grief was to get very involved in school. So I did all the things. I was in all the honors and AP classes, played tennis on the high school tennis team. I was on the mock trial team, CSF, you name it, Key Club. I was literally doing all the things. I even had a job as a 16-year-old. I worked at a movie theater Friday, Saturday nights, closing. But that was the way I could focus my energies because I knew I had to make it. There was no plan B. There was no backup plan. It was going to be me and I was going to make it. And I was going to help people. That was really, if you can imagine the fierceness of a 16-year-old or a 17-year-old, how passionate we are at that age, I was very focused. And so thanks to California, the Cal Grant and financial aid and everything else, I was able to get a very good college education at Occidental College, where it was actually based on financial aid. And this is a whole other wild thing we talk about for hours. Education policy is quite fascinating to me. My financial aid package at Occidental, which is a private school, was more robust. And it ended up being cheaper for me to go to Occidental than it was for Berkeley, UCLA, or UCSD, which were the three public institutions I had acceptance letters for. And so at the end, it was an affordability issue. And my dad said, you have to go where it hits our pocketbook the least. And so I did walk away from a public higher education simply because of financial aid. But I made the most of it. That's how I got to study a year abroad. I did my bachelor's in biochemistry, but I also did a minor in religious studies. And if you think back to the 90s, that was a time where we were doing stem cell research. Stem cell research was very exciting in those days. And my thought was, here I am growing up in the US. Many of our laws and policies are shaped by people's moral beliefs and ethical values, tend to have roots in Judeo-Christian beliefs. And so if I wanted to understand what policies might regulate the kind of research that I would be able to conduct, I wanted to know where those moral codes that shape policy come from. And so I did take religious studies as a minor and studied all different religions, and it was great. At the end of the day, I learned that we have more in common than we do apart if you look fundamentally where our value systems come from.
I definitely appreciate the curiosity to kind of understand a different perspective. That gives us so much. It's leading with empathy, trying to understand what these other rules are that maybe other people may believe in or follow, that versus being, oh, this is different or wrong. It is like, let's learn about them. Let's talk about it in a way that we can actually relate to each other.
Yeah, I think if we all become lifelong learners, I mean, look at your journey, right? You've challenged yourself in new and exciting ways as well. If we're all lifelong learners, I think we all do better. Life is here to teach us lessons. We might as well be good students.
A great way of saying it, because yeah, it's going to teach us lessons whether we like it or not. But it's a nicer path, I think, if you're ready to be a learner.
Also, that's what being a scientist has taught me. When I was in undergrad, I did undergraduate research, and my older brother, he's a PhD chemist, he gave me some great advice. He said, as elder brothers do, he said, 90% of your work is going to fail, so get used to it. It's just part of the journey. And I think that really helped me approach everything I do, knowing that they're failures, but they're failures that it doesn't mean that it's bad. It just means it's part of the learning. Failure is okay as long as you learn from it.
As I get older, I've been reading the Gita a few times, and I realized, and this is stuff I would hear from my granddad and from my grandparents and my dad, and I thought this is their wisdom, but then I realized later when I read it that this has been around for thousands of years. And essentially that one of the key messages is that you only have a right to your effort, not the result. Almost like what you're saying, that, a lot of what you're trying to do is going to fail. You just really need to put your best foot forward. And what happens next is not really in your control.
And to approach it with humility. You know that if you have that self-awareness and you have that humility with which you're approaching work, your ego is set aside. I know, like in our traditional Hindu philosophy, in our teachings, we talk about letting go of the ego. You don't do the work for yourself. You do it for everything outside of yourself. And, if you let that go, then when you do encounter a challenge or something that you've believed in doesn't work or something you've tried, like now I'm working on policy. I approach the policy work from the same way I approach my scientific work. If it's not giving the results or the outcome that we expect or we want, we have to go back and revisit it because people are impacted by the work that we do. We have to keep that open mind that, hey, maybe I didn't get it all right, or maybe we did have a blind spot and we need to go and fix that.
Okay, so the decision to go from a traditional career in biotechnology to community leadership space and thinking and running for the Poway Unified School District. What was that decision-making process for you? What made you finally make that decision and take the potentially risky, I'm sure people advise like, why are you giving up your job?
So even my family said, we thought you were going to be a biotech CEO. What are you doing? What are you doing?
What did you see that made you do that?
The beauty of my life experience, you always have to look for silver linings. We lived on very little growing up. Some days, we actually were on the reduced meal plan because my dad was out of work and we would constantly change our environment. So change was normal for me. Risk was normal for me. It was part of how I built my own resilience. I didn't know the word resilience growing up, right? This is a new word for us in our lexicon. But I look back and surely it was resilience. So what happened was in 2009, while we thought we had done everything right, we were living that American dream. I had 2 daughters. My husband was working at Sun Microsystems. He's a computer hardware engineer. I was working at Genentech, just really exciting cutting edge research in oncology work. And I thought that's it. We had arrived. We're doing all the things, right? Still struggling to afford to buy a house. Shockingly. In 2009, we were waiting for prior authorization from my dad. He also had a existing medical condition. Of course, now we have ACA and we have Medicare. So my dad had a physician and he was being treated. But while we were waiting for that prior authorization, there were some delays. And unfortunately, we found ourselves back in that same ICU where my dad had to make an end-of-life decision for my mom. We were making an end-of-life decision for my dad. And, 21 years later, literally, St. Mary's Hospital in Apple Valley, California, same ICU, 21 years later. And I'm thinking, where have I come? I thought I was doing the right thing. I thought we were making progress. I have since met people that have been treated by medications created by Genentech. And so I knew we were changing lives. But at the same time, I realized very quickly that what is the point of these cutting edge life-saving therapeutics, custom tailored, personalized medication, if you can't even get timely care for the basics? Like you're waiting on this prior authorization, right? And so that was a light bulb moment for me. And my husband and I had that classic dinner table conversation. What are we doing with our lives? Both of us were working very hard, sometimes 50, 60 hours a week as it goes in Silicon Valley. And kids were in daycare and preschool. My older daughter knew Portuguese words and would say them in her dreams at night. And yet she would never speak Gujarati or Konkani in her dreams at night. So, it's this moment of how are we raising our family? What are we doing? Is there something we could do better and different? Is there a way I can give back in a different way? Maybe it isn't biotech. There are plenty of people out there that are brilliant research scientists, but maybe I have some skills that I can apply in a different space where I can make a bigger impact than oncology research. So we packed it in. We packed up our stuff and we moved to San Diego. My husband got a job at Broadcom down here in San Diego, and I decided to take some time off. We had a 3rd daughter, and I decided I was going to use that time to give back to community. We moved around a lot as kids. I didn't want my kids to go through that. I wanted a forever home for them. I wanted to put my roots in deep. And so I realized part of how you build roots in a community is by volunteering. So I started volunteering, and the story is known from there, right?
Wow,
But like a
yeah.
scientist does, I started chasing problems. I was on a PTA I was on the school foundation and I realized, oh, well, there isn't appropriate money and we're getting cuts all the time. Why are we fundraising all the time? How does this work? Are we managing our budget? Wow, look at the school district. The superintendent was embezzling money. There are all these questions. And then you realize, oh, wait, I can be part of the change that makes things better.
So once you ran for the school district office and you won, once you do that, though, I think a lot of times we want to make a lot of change, but when you enter the office, then you see there's so much more inertia and red tape and things. So what was surprising to you when you actually entered and saw, okay, this is different than I imagined?
Well, you hit the nail on the head. And I think every time you step into a space in a leadership role, then you realize what the molasses really feels like, right? It is definitely everywhere you go, whether it's being a leader in a FQHC space where there's definitely bureaucratic red tape all the time that you're facing, or it's in public education, or frankly, it's in private industry. There's definitely processes in private industry as well. So yeah, very quickly realize that you have to count to 3 on a board of 5. You need a majority. I'm not bad at math, so I figured that one out really quickly and worked to make sure that I had good relationships with my colleagues, with staff, and learn to be a little patient. I think sometimes it's hard to be patient, but what you can do is the prepared mind is ready for the opportunity. So even though you know things are moving slowly, if you yourself do your homework and have everything ready to go, when the moment is right, you can deliver. When I first came in, I was the first person of color to be elected to the Board of Education in Poway Unified. And we know our demographics are shifting. It's becoming more and more diverse. Every single sale of a home, every single construction of an apartment complex, it's becoming more diverse. And we love our diverse communities. We're very proud of them. We all get to learn from them. But one of the first things we did with me joining the board was we created a culturally inclusive calendar. And it was a simple thing. Students actually asked me to do this because what they realized is they followed a lunar calendar for their festivals. And by the way, more people across the world follow a lunar calendar than follow a solar calendar for their festivals. Whether it's the Jewish community, Muslim community, Hindu community, East Asian religions, you name it, people are following a lunar calendar for their festivals. And so this student approached me and said, hey, my counselor doesn't understand that Ramadan falls on a different day every year. Just can't conceptualize that. Can you help me introduce a culturally responsive calendar when you become a trustee? So we did that and we started having those conversations little by little. They weren't big changes. But then when we had that opportunity with political events, national political events during COVID that were happening with the Black Lives Matter movement and with DEI work happening, we realized there's an opportunity to then have those bigger conversations around what does our discipline disparity look like? What does our access to higher, more challenging coursework disparity look like? The students in Poway Unified started an Instagram page called Black in PUSD. And boy, was that revealing. You could see how much misunderstanding and basic discrimination, bias, was having an impact on our students. And it turns out it wasn't just Black kids that were responding. It was Asian kids, it was Latino kids, it was LGBTQ kids. They were all saying how they had experienced bias within the system. And we realized there's something we could do as a school district, at least having those conversations. Where do we hire from? Who faces, are there discipline disparities that don't reflect the population of our community? Which kids get encouraged to do career technical education versus AP classes? And it turns out there's a difference, and those differences are not okay.
Yeah, some of this is so embedded even within medics, even in psychiatry, especially for a long time. From a diagnostic standpoint, patients who were African American were more likely to get diagnosed with psychotic disorders than people who were not, right? So that's hopefully changing.
And it's good we're having those conversations because then when we look at clinical trials or we look at patient populations, we can question, is this bias or is this genuine? And we can improve our practices so that we don't overdiagnose or misdiagnose. We see the same thing in our special education population with our English language learners. We see an over-identification. And that creates challenges too.
In your role at PUSD, what came forward for you about children mental health and adolescent mental health? What kind of issues did you see occurring repeatedly, or maybe solutions that the school district was thinking about?
So, one of the things that I was very focused on, and I still am very focused on, is youth mental health. We know that there are pressures on our kids today. This isn't just post pandemic. We also know that it was increasing. Youth mental health issues were increasing prior to the pandemic. I think our kids today face all different kinds of pressures. I'm not saying they're more or less than previous generations. I'm not trying to cast any kind of judgment there, but they're facing a lot of pressure and they're very hyper aware. They have all the words for the pressures they're experiencing. They self-diagnose very easily, but they're not receiving the support and actual care that they need. And we see that either they're worried about their futures, the environment, whether they'll be able to afford a house, how many jobs will they have to have, how perfect their scores need to be. Is there room for failure? In science, we learn about single point failures, right? I took my daughter to see the construction of the Webb telescope, and there were 300 something single point failures. I think our children believe every homework assignment, every test, every class is essentially a single point failure. And they're constantly in fear of, if I don't do this perfectly, does that mean I won't get to do XYZ in the future? And I think there's a lot of worry about that. If I don't score that goal, if I don't make this team, if I don't get chosen for first chair, if I don't get the lead part in the play, there's so much worry that they have that every single thing will determine which fork in the road they get to take. And I would love to wave a magic wand and release children from that pressure with my life experience with so many setbacks that I've had in life. I mean, the first time I lost an election, I was running for a high school ASB president, and I really thought that I was the best candidate. Everyone said that, yeah, you're going to be ASB president. And out of the blue came a woman, a girl who ran against me, and she had experienced a life tragedy. And there was so much outpouring of sympathy for her. And there was no way. Like, that was it. That was gonna be her moment, and it was nothing that I could control. You can control what you can control. You can't control things outside of you. And I really thought that was it. I'm never doing public service. I'm never gonna run for office. I'm never gonna do anything like that ever again. And I thought that was a single point failure as a young person. And look where I am today. So I wish I could give children the wisdom of life experience so that they know they're gonna be okay. They're gonna be okay, but they don't have that right now. And I would love to see a system where we provide better services for our kids to give them that assurance that they're going to be okay.
I think it's maybe it's part of being a child or growing up that you think each individual event is so important. Though as you get older, you realize, okay, it's a string of failures and wins which put together where you are. And oftentimes, many failing experiences are very informative and push you to growth that success in that moment may not have pushed you there. It's probably tough to explain it to them fully because some of it is maybe just about living life, longer and figuring that out. Let's talk about your run for the assembly and what are the challenges in the election process for you?
As a scientist, I chase problems and I look for solutions. This is what we do. And so, as a school board trustee, I was increasing my leadership opportunities. And when you do that, you also increase your awareness of what's going on around you in other school districts, other parts of the state. So, as president of the San Diego County School Boards Association, I got to understand better what was happening in rural communities, urban communities, what their challenges were with public education and the struggles that their children were having in their communities. I became California School Boards Association delegate during that time and also on the legislation and policy committee. So those committees gave me the opportunity to see a public education from a big picture, from the wide lens. And while I was a school board trustee, we always faced these new laws that would come from Sacramento, unfunded mandates. Now we have to compost all of our food. Now we have to provide food for everybody. Now we have to teach this subject. And while public education, I think, wants to do all the right things, they want to. Our school district wants to do everything they're supposed to do. Oftentimes, regulatory policy landscape is so complex and so demanding that it's very hard to actually successfully implement everything the state is asking. And I saw that very close and personal. And then I realized that half of our school districts in California are considered small school districts. And in a small school district, they have a very limited administration team to support classroom instruction. So you may have a principal who is also the superintendent, who's also the IT specialist, and who also does HR. And so then you take this principal, superintendent, IT, HR person, and you make them also deliver high quality education and follow all the new laws. And it gets very challenging very quickly. We're fortunate in Poway Unified that we don't have that in one person. We have that in many people. But regardless, what it means is that our classrooms get strapped. With each unfunded mandate, money gets taken out of classrooms. There's a potential for increasing class sizes. There's a potential for missing the mark when it comes to fulfilling IEPs or things like that. So the challenges stack, the financial burden spirals, and it gets to be a point where really education can't do what it wants to do. And we see that. We see that in our general test scores across California. While we're slowly improving from where we were in COVID, I think the numbers still show like 30 or 40% of our kids are not proficient. So we need to do something to fix that. And that call to action came to me pretty heavily. When this position to run for state assembly opened up, I said, you know what, I'm just going to go for it. I went for it with school district, and I think I'm just going to go for it, do the best I can, and we'll see where it leads. At the end of the day, I'm here to serve the public. I really believe that. I'm here to listen to the problems and try to solve them. And that message resonated with voters. And now I have this wonderful opportunity. I feel so honored and so fortunate to fight for our community up in Sacramento.
That's amazing. I think it's really inspiring for you to hear about your journey. And I think taking that risk, taking that chance on something that's bigger than you, and let's see how I can contribute. And the impact is going to be a lot bigger than that. But now you're in the state assembly, right? Let's talk about what was almost jarring, or you thought, okay, this is different than what I expected when you first started there, but you were ready also.
Well, I think ready is a relative term. I go in with an open mind. And I think that's, it's that concept of lifelong learner. So as long as we approach things from that space of humility, that I'm here with good purpose, I'm going to work with the colleagues that I have to move the needle. That's the goal on behalf of the people that I serve. And so I think coming from school board space where we saw these unfunded mandates and these unintended consequences, looking at our housing shortage situation, the affordability crisis we're having in California, where things just keep increasing in cost, whether it's our gas prices or our homeowners insurance or housing in general, food costs, everything is just electricity, utilities, water, everything is just increasing. So you take a middle class family who 5 years ago could budget, and even knowing that they would get some incremental raises through their work, it was never going to keep up with the rising costs of everything around them. So, going into the assembly with the mindset of, I'm going to tackle this issue. I want to deliver high quality education. I'm going to try to figure out why is it our education system is not delivering, despite Prop 98 committing 40% of our state budget to public education. We still can't deliver on that. So what is really at the center of that knot, that giant tangle mess of policy? Healthcare, access to healthcare. We're still dealing with access to healthcare issues. How are we going to unwind that complex problem and find what's at the center there, or multiple centers of what's causing healthcare costs to increase year over year? So I go in with this clarity of purpose. I'm going to tackle affordability issues, strengthen our healthcare access, and improve the quality of public education. So I arrive in Sacramento, and I realize very, very quickly that, well, the reality is I now know how we get bad laws. And I say that kind of jokingly, but with some amount of sincerity and seriousness too. So we join these committees, we get assigned committees, we request to be put on committees. And if we're lucky, we get the committees we request. It's like high school course request form, right? You hope that you get the classes you want. And you're busy like trying to craft legislation, looking at other people's legislation. And then on your committees, you have a committee hearing. And in a committee hearing, you may have 20 bills you're hearing that day. So if you just dial backwards, committee hearing may be on this day, 72 hours before the agenda is set. And that's when my committee staff get briefed on those 20 bills. And then within that time period where they're briefed, they have to brief me. Sometimes it's only 24 hours, by the way. Sometimes it's even tighter than 72 hours. So they get briefed, and then they have to brief me on these 20 bills on a hearing, and I have to be able to vote on that. with whatever that little window is. Now, maybe some of the bills that are higher profile bills will have had advocates come in, labor partners come in, maybe even industry experts themselves or lobbyists come in and talk to us. But many of the bills don't have that much advocacy or information surrounding them. So you take a bill, perhaps it's very, very impactful. It's going to affect billions of dollars, millions of people, and I get 24 hours to decide how I'm going to vote on this. I'm a fairly quick thinker. I feel like I'm a fairly decent problem solver, but even I have been stymied with that short window. It doesn't give me much time to call in people on the ground, ask them, hey, how is this going to affect your work?
Right.
How is this going to impact your ability to deliver solutions for the people that you're serving, your customers, your constituents? It gives us very little time to actually figure that out. And at the end of the day, if you want to vote against what the chair is recommending or make a decision, want to add an amendment to what the author has proposed, you don't have much time to do that. It's a very short window. And by the way, there are 20 of these bills. And sometimes there are two hearings that are at the same time. And you're running back and forth between two hearings. So this isn't natural law. This is a social construct. We've created this system. Many, many human decisions have created this way, this policy framework, this legislative process. People have made intentional decisions on crafting it this way. And it's not like a thunderstorm like the one we're experiencing now, like where it just comes, we can't do anything about it. We've created this system. And of all the things that I've experienced in Sacramento, I think this is the one thing, if we can change the way that we approach policymaking, I think we can deliver better, more effective policies for the people of California.
That is such an incredible insight into the short-sightedness of how some of our systems are being designed and decision making is being forced to happen. I definitely see it, and I'm sure you saw it. Like a lot of our organizations are making decisions very short-sighted. There is no long-term planning. If you do this for 5 years, then you'll have amazing outcome. Same thing as you're thinking about school board funding. That requires more than 72 hours of your time to really understand it well and vote on it. Or at least, are we going to negotiate how this is going to go? Are we going to edit it? Are we going to get feedback and then modify it? I think that there is so much lost because it is, I absolutely agree with you. For a long time, I would give a grace to many systems, but I truly think now a lot of systems are designed to be the way they are by powers that benefit from them being designed that way, things being rushed, things being short term, because then the short term process really doesn't allow you to think long term and long term major impact.
Yeah, and I can even give you a specific example that is really challenging right now. I'm chair of the the Select Committee on Youth Mental Health and Treatment Access. And we are having a hearing here in the district on December 2nd at the Live Well Center in Escondido. We have several panels we're doing in this Select Committee hearing, including our local government, so our county health and our county office of education, a local school district. We're doing providers, so Rady's Children's Hospital, the Sharp, as well as Aurora Behavioral Health, and then some nonprofit providers, YMCA, et cetera, and then a bunch of students that are also going to tell us their perspectives. But what we've seen in this whole process when it comes to youth behavioral health, we had this great governor's initiative, the Youth Behavioral Health Initiative. And one of the exciting aspects of that program was going to be for school districts to be able to bill back to the state, to Medi-Cal, behavioral health or mental health services. At the end of the day, those are not education-related services. They're health-related services. And when school districts have to cover the expenses of those, it takes away from classroom instruction. And it's a compounding multiplier effect, right? We need to be able to, we know where the kids are in public education. So certainly we would want to provide them the help because it impacts education. At the same time, it's a medical issue. And we need to treat it like a medical issue with ongoing continued support and funding. While we started with cohort 1, school districts were excited. They did work to onboard psychiatrists, social workers to be able to provide and deliver those services that we were going to offer our children. But then the billing process was so complex, and those that were doing the billing are the providers. So they're trying to help kids and at the same time figure out the reimbursement paperwork process. They didn't have time to get the training necessary. And they're throwing their hands up. School districts have hired people, but now they're not getting the reimbursements. So they're having to let people go. And when young people look for career pathways and they think, what is going to be a good, stable career for me? They see this fluctuation in hiring and releasing of mental health support staff, of professionals, degrees that take years to earn and student loan money to have to repay. And they see this fluctuation in hiring and terminating these positions. They may second guess, why do I want to be a psychiatrist? Why do I want to be a social worker? Society isn't going to make my job stable. And so you see this negative feedback loop. We want to do the right things. The governor, it was a great initiative to do this. This is what we needed at the time, but it's not rolling out quite the way we hoped it would. So as a scientist policymaker, my quest right now is to figure out, where did it go wrong? What do people on the ground suggest as possible fixes? And then what is our pathway towards making those fixes? The sooner we have those honest conversations, the sooner we can address them, and the sooner we can get our kids the help that they need. And our workforce feeling stable, that they can, it's worth investing years and money into a career pathway that will actually give them an ability to live in California.
I have some thoughts on this, but so I've worked on creating many different mental health programs, and like for serious mental illness, co-occurring disorders, maternal mental health, autism, and pediatric mental health within the clinic setting. The school mental health piece, right, is the most difficult piece to figure out. It was easy. I'll tell you, it was easier for me to hire a psychiatrist and a therapist than to figure out the billing in the school system. At least two school programs from the mental health organizational perspective I was responsible for, it was a nightmare to figure out the billing. I had the staffing, I had the resources to get that done, but if you cannot make it sustainable for any program, whether it's a school or a clinical setting within the school, they just cannot do it. And I think a lot of the policy, I've overseen probably over $20 million of federal funding, state funding. A lot of the policies and grants that come out, I think one gap they do have is thinking about the caregiving team first. So it's a little counterintuitive. Oh, we want to design it for the patients. Absolutely. But if you support your school team well and make it easy for them to bill, easy for them to hire, they will do that work really well because they do want to do it. It's just that you have made it really hard for them to do something they want to do. And I think that's the gap in implementation of policy that I've seen often, that you don't give me any funding to make sure I can call the psychiatrist, that the person who needs to call the team to make sure there's communication is everybody's on the same page. That's critical in that care, so those are the gaps. Oftentimes in implementation, those get very apparent, and that's why a lot of amazing policy doesn't get implemented the way we thought it would.
Yeah, you've really hit the nail on the head. I think this is what we're hearing. Hopefully, this hearing, that the select committee hearing that we're having on December 2nd, hopefully we'll be able to have that on record. And that having it on record, on state record, will then provide me the groundwork I need to take the next steps. And I'm not the only one. We have a whole legislature full of policymakers that want to address this issue. It's just I'm bringing a different approach. I'm trying to do it from ground up, evidence-based. Let's gather our data. Let's make a strong case. I did mock trial as a kid in high school. I understand what it takes to build a case. So let's build that case and make sure that we're able to deliver in a sustainable way. And if we can do that, we'll change the world. Because what happens to our kids impacts generations to come. If they have their confidence and their resilience, then they will know how to tackle the problems that we can't even identify right now. We don't know what the problems are that the next generation will face. We think we know, but we don't. But we need to give them the core set of skills to be problem solvers, to have confidence in themselves, to ask the challenging questions, to know that it's okay to doubt, that is an okay space, but then to change that doubt into wonder and then take the next step. That's what we need to do. And we know that we have this opportunity with our kids in schools to help them, but we need to make sure that schools are adequately resourced to deliver for our kids.
As a child psychiatrist, I have worked with schools all along. And in many ways, before I had my kids, I had a different view of why schools are doing things the way they're doing them. And now I do see, even in good school district, teachers are dependent on donations for simple things to make it work. So I understand when you have to go above and beyond, which is just like healthcare, where our people are expected to go above and beyond. The minimum you're expected to work is above and beyond every day throughout your career. I think that's how the school system also is set up, with under-resourced, underfunded, understaffed.
Well, there's this concept that you're doing this public service because you love the work. And so because you love the work, that's reward enough. And frankly, unfortunately, in California, because there's such a high cost of living here, that reward is not enough anymore. And if we want to have the best, if we want to recruit and retain the best talent, the best workforce, we need to make sure that they're adequately compensated and that their work is predictable, that they have some kind of, steady supply of the resources, the tools that they need to get the job done. And we just don't have that right now. But I think there's a strong desire to deliver on that. I've met some amazing colleagues in the assembly, some that I adore working with, that I find them to be equally passionate about solving problems, maybe in different spaces. I have a colleague who's very committed to supporting menopause research, for example, another black box area that we're not really investing a lot in. But boy, we could change lives. Women have many years to live post menopause, and we should make sure that they're able to care for themselves and be well into their sunset years. We have folks that are very worried about energy independence and housing shortages. And I think all of it is interconnected. And we need to learn how to work together, even across the aisle, frankly. We need to do a better job in just meeting the needs of everyday people.
Other than the youth behavioral health focus area for you, are there other healthcare areas that are your priorities in the assembly?
Yeah, so I've been very focused on Palomar Healthcare District recently. It is the largest public healthcare district in all of California, officially serving over, I think it's 850,000 people. But if you count public access to maternal healthcare, so maternity ward, labor and delivery, it's the only public facility delivering healthcare for labor and delivery to over 1 million people. So the success of Palomar Healthcare District is directly tied to the well-being of North County, all of North County, frankly. And so when we saw, a few years back, the challenges that Palomar was facing, it quickly rose to be a high priority item for me once I got into the legislature. Very early in my first year, I was approached by a lobbyist for Assured Guarantor, who holds the bond for Palomar Hospital. And they informed me that the hospital was going to default on a second payment. And if they did that, then they were going to take action as bondholders do. And that would not have been pretty. That would mean Palomar would go into bankruptcy. And I wasn't ready for that to happen to my community, especially for public healthcare access in California. But in San Diego and North County, this is a public hospital that serves several tribal communities to the east of us, several rural communities. Fallbrook Healthcare District closed its hospital. Tri-City is going through its own challenges. It shuttered its labor and delivery ward while it restructures. So, lots of challenges with public healthcare access. And we know there's increasing costs. And if you look at Palomar specifically, I think 80% of its patients are on Medi-Cal. So, that the lack of appropriate reimbursement rates definitely have their impact. But this was specifically for the construction of the hospital that would lead to such financial trouble. So we quickly built relationships with the state treasurer, Fiona Ma's office, and we work closely with folks that understand hospital finances better than I do, got up to speed, and we realized what we needed to do in short order was create a policy that would allow the state treasurer's office to put forward a bridge loan extension. And that would not be a forgiving of the loan in any way. So we're not shorting our taxpayers. I feel very responsible for taxpayer money. I believe that we have to be good stewards. But this would give them a little more time. And time is what they needed. In the meantime, we were able to get that passed and signed into law. So they got their bridge loan extension, which was great. And in the meantime, UCSD has now entered into a JPA with Palomar, helping stabilize things even further. And so we're excited about that. But then we saw a B chip again, when we're talking about mental health dollars. Palomar was awarded a $50 million B chip grant, which was very critical to North County, considering that Tri-City did close its inpatient mental health facility, behavioral health facility. Unfortunately, that grant was rescinded, and there were some reasons cited We convened a roundtable discussion with the leadership of Palomar, included other legislators, and we discovered what the cause was. And so we followed up with a meeting with the California Department of Health, and we figured out like what we needed to do. And now I'm championing and advocating, put in official letters in support of round 2 funding for Palomar. And hopefully they will be awarded that. We don't know. There's a process that they have to go through. I did not preview the application. I don't know what that application process looks like, but I know that I'm doing everything I can to ensure that Palomar can deliver for its constituents. And part of the plan, hopefully, if we get that BCHIP money, some of those beds would be youth specific, which would be awesome for North County. We need to have that treatment modality available in North County for our young people, especially for young people. Families don't want to travel an hour to visit their child when their child is experiencing crisis.
That's amazing. You've been busy.
Yeah, I've been busy. Yes. It's all good for good reason. I feel very inspired and motivated by the people that I serve. I have to say, we did this wonderful thing for Thanksgiving. There's Thanksgiving turkey dinner. As just something we do for community, we decided to do a Thanksgiving turkey giveaway. And we set a very ambitious goal of fundraising to donate 1,000 turkeys, but it's not just the turkey, it's the dinner box. So we're giving the side dish box as well as a produce box to go along with that. We fundraised enough to cover our stretch goal of 1,000 dinners. But on top of that, we raised more and are giving $9,000 back to the food bank. So, and you should see the community so appreciative in these really tough times where food banks are struggling, where the government shutdown impacted. We're a very military heavy community. So a lot of people were without their income. And on top of that, we know in San Diego, our active duty military are the number one customer of our food bank. And so you take those families that are already not getting their income and you take away their ability to get food also on the other side where they normally go to the food bank. They're really scary times for our community. So excited to be able to find ways to give back also, not just solving problems in Sacramento, but trying to help people here at home too.
That's, by the way, that's a sign of a great leader. You're connected to the ground at all times to really know what's happening, because I think otherwise leaders lose why they're doing something, but like knowing what's going on the ground is really a great way to just be a good leader. Let me ask you last couple questions.
Yeah.
Some guidance around a youth or somebody wanting to get involved in community leadership. What suggestions would you have for them?
For youth and adults, I'll give some advice because it's never too late to be a community volunteer. You can do that at any point in time. Focus on what is interesting to you. Where do you develop your passion? What is something you have passion for? Because volunteer work is hard. It's self-motivated. You're accountable to yourself. As a volunteer, you're committing to an organization, but they can't fire you. So it really, you have to want to do the work and you have to be very committed and passionate about it. So find what you're interested in, where you want to move the needle, what is important to you, and then find a way to get involved. And understand that just because you may come in with skills and think you're very capable, sometimes you have to start off at the ground level, and that's okay. Every good leader understands what the range of workers in their organization are doing. You have to understand what the day-to-day work is and the people who are working at all levels in your organization. So start off at the bottom. It's okay. Do the grunt work. You learn a lot. And in fact, you can see perspectives of where the flaws are or where the inefficiencies are by working at the ground level. In Poway Unified, I regularly would speak to the cafeteria workers and the custodians and noon duties because they would tell me, hey, the new program you have for purchase orders, it's really not how we do our workflow. And it's actually making it harder for us to order supplies. So can you and they felt open and comfortable enough with me to talk with me because I also kept the door open for them. So if you understand and work with people at all levels, that's a good way to start. And then find a way to give back in your local community because volunteering is hard. It's rewarding for sure, but it's also hard because, you have to figure out how you're going to fit that into your daily life. Find out a way to do it that's going to impact the people around you. That way there's this reward system, right? You're making a difference. Big organizations are great. Definitely do all the fundraising for American Cancer Society or, all these big things. That's also great. But find a way to do it locally. We don't really teach in school about local government. We don't really teach even about state government. the way we teach about federal government. There's a US government class, there is no California government class. And so finding ways to volunteer with your local city council, volunteer on the local town councils or planning boards, see what's going on in our local areas. We have so many local offices. They're called LAFCO boards, water districts, school boards, hospital boards. There are all these opportunities out there for elected office. But before you jump into these local elected positions, know what that work looks like. And then, I just say you should make it part of life, like you make exercising part of life, like you make reading a book part of life, or going out and hanging out with your friends, going to see a movie. Volunteerism is something that keeps all of us together. And the more that we go out in community and volunteer, we're mixing with different kinds of people from different parts of society. And then we're actually having real conversations. These aren't polarized social media conversations or online conversations. These are conversations with real people. And that will help us be stronger as a community together when you get to meet people and get your hands dirty with your neighbors and other community members. You may find that people have different opinions than you, but your core values are in common. And that breaks down those barriers that have been put up by social media and screen time.
That's great. And the last question I like to ask people, what is the most exciting and the most difficult problem you're working on today? They don't have to be the same. They could be the same.
Yeah, most exciting is definitely I am looking towards improving systems and structure. I think if we have a better process, a more equitable system, a structure that's more predictable, then more people can participate in government. We can have more educated citizenry or residents in our community. The more educated we are about government and process, the better we can advocate for those resources back to community. So I think that's one thing that I'm very excited about is just pushing that out there. Any chance I get, I want to encourage people to get involved and to learn and study. And what happens with laws and policies affects your daily life. So get involved. I think I'm excited to see civic engagement increase in the last few years. And hopefully that's sustainable. Challenge. Wow. I have this vision that I really want to take on improving public education in California. As the fifth largest economy, putting 40% of our state budget towards public education, I think it's unacceptable that our kids are not accessing a high quality education that they deserve. And I think we could build a really strong coalition between local and state level policymakers and community members to invest in our own future. We have to remember that the kids coming out of school now, they're the ones that are going to be taking care of us when we get old. So if it's not for anything other than selfish reasons, I say it's worth the investment. But for those of us who like to think about generations to come, the time is more than due to fix public education in California.
That's, again, that incredibly inspiring. I think I am sure a lot of people are going to be inspired by this, by your wisdom and what you shared about your own journey. But I'm definitely inspired myself. And thank you for joining me today and sharing your journey, sharing your vision. I think it's been great to talk to you.
It's been wonderful. Thank you for having me on your podcast. Look forward to maybe another one in a couple years or next year. We can
Absolutely.
do a check-in and see how things are going.
That'd be great.
It's
Thank
great.
you so much.
Thank you so much.